Hi, my name is Kathleen Bell, and I'm here today to talk to you a little bit about the life of a PM&R physician. So you might ask, what is PM&R? PM&R stands for Physical Medicine and Rehabilitation, and doctors who practice PM&R are called physiatrists. PM&R is actually one of the 24 board certification medical specialties, just like orthopedic surgery or neurology or any of those types of specialty areas. I'm an MD, and we have DOs who also practice in physiatry. Many people don't quite understand what it is that physiatrists or PM&R physicians do. PM&R is a specialty that really looks at trying to optimize the function of people, whether that's their physical function or their cognitive function, and also to enhance their function in the community. So we don't exactly treat a single organ like the heart by cardiologists, and we don't treat just a single disease state like cancer. We will actually treat a number of different disorders, injuries, chronic illnesses, acute illnesses, but we do it from a different aspect, one of returning functional abilities to people. We occasionally serve as primary care providers, particularly for people that have chronic neurological injuries, for instance. But often we work in a team with other physicians, and I'll talk more about that when I share a story of one of my patients later during this little presentation. So let me tell you a little bit about my practice. As you can see from the slide, I work at the University of Washington in the Department of Rehabilitation Medicine. In my particular kind of practice, I'm in a large academic medical center with a medical school, and of course that's part of my daily life. My department has, probably about 30 rehabilitation physicians and quite a number of psychologists and other personnel as well. I primarily work in a university medical center, which is attached to the medical school. And it's a fairly large medical center with about 400 beds, and I do a number of different things within this setting. I am what's called the chief of service, which means I run the department. I'm in charge of kind of developing strategic planning for the department, doing quality analysis. I'm responsible for the safety of patients within the rehab services. So I work a lot with all of our various staff and personnel in developing these plans and quality controls, and I also work with the hospital-wide as well to give rehab services to patients in other parts of the hospital. So for instance, if patients have surgery, the physical therapist and occupational therapist in my division will go over and help to get those patients mobilized after surgery. Often our rehabilitation physicians will go see patients who are on those services, acute surgical services or the intensive care unit, to start working with improving their function within the hospital, getting them up and moving around, doing what they need to with medications to make it more possible for them to take care of themselves and to communicate. The other thing that I do is often work on our acute inpatient rehabilitation unit. So I actually act as the primary doctor for those patients while they are in the acute rehabilitation unit. On our unit, we have all kinds of patients. We may have patients who've had acute injuries like spinal cord injury or brain injuries. We may have patients who've had strokes. We may have patients that have had transplanted organs and have been in the hospital for many months and have developed a lot of muscle weakness. Being in a university setting, we have patients with some pretty unusual things sometimes. So it's a very diverse unit that I work in. I also see patients in our outpatient clinic, which is a lot of fun because these are patients that I take care of over a number of years in terms of taking them from either from the hospital or when I first meet them and trying to improve the quality of their function in both their physical status and in their family status and their community status. In addition to that, I teach. I teach physical medicine and rehabilitation residents. I teach medical students. I teach physical and occupational therapy students. I also teach graduate doctors by lecturing out in the community and across the country, actually, as well, and that's a very important part of my job. The other part of my job is that I do research. About half my time is spent in doing research, particularly in the area of traumatic brain injury. So I actually run research projects, evaluate patients for research projects, do data analysis, share my data with a lot of other research centers across the country, and try to find out new ways of improving people's function, particularly those with traumatic brain injury. So some of the things that are wonderful about my job is that I never get bored. I have so many things to do and so many exciting new people to meet, young students, new patients. I get to share my experiences across the country, which is wonderful. Of course, one of the challenges of the setting is that there are too many things to do on a regular basis, but I guess that really is the fun of it. So what is my role within a care team? First of all, I work a lot with other physicians. I will frequently have patients sent to me from other physicians, family doctors, neurologists, surgeons, even chiropractors or other people in the community to see and consult on their patients. And I often, again, will send my patients back and forth, too, because really healthcare is a team sport. There are things that we all do well and things that we have to get assistance with from other specialists. I work very closely with other members of the rehabilitation team, and that includes physical and occupational therapists, speech pathologists, psychologists, rehabilitation or vocational counselors, nutritionists, respiratory therapists, social workers. And the other group of people that I work with a lot are people out in the community. So I work with employers or schools or government agencies in trying to make sure that my patients get the help that they need. So I can tell you a little story about one of my patients that might illustrate some of this. I'm going to call my patient Sarah. Sarah was a young graduate student, late 20s, early 30s, who had a very unusual kind of stroke. This stroke was very severe and landed her in the hospital for quite a period of time. And I first started taking care of Sarah while she was in the hospital. In the hospital, I took care of her as her primary medical doctor. And I also led the team in developing a comprehensive plan on improving Sarah's function so that she could get back out of the hospital and back into the community again. One of the areas I worked with was Sarah's swallowing. She was having a difficult time swallowing. So I would order specific x-rays to evaluate her swallowing and review those both with the speech therapist and the ENT physician to develop a plan on how certain kinds of injections and techniques would improve her swallowing. I worked with giving her specialized equipment so she could get around. One was a power motorized wheelchair. It also included some braces for her ankles and legs. She had a lot of spasticity in her arms, which was very uncomfortable and caused her arms to jerk a lot. One of the things I did was to do injections in her arms that would decrease these terrible, painful spasms that she was having and allow her to start using her hands to do things. She had problems with things like sleep and a little bit of depression, and I was able to work with her with giving her medicines, for instance, and getting her the good counseling that she needed to continue improving. I continued to work with Sarah when she left the hospital to return to her apartment, and I worked with her getting community assistance and teaching her family how to help Sarah make this transition. And I think one of the really wonderful things has been to help Sarah return to graduate school. She's been back at graduate school now for a year. She has had to adapt to what she's doing because she's never quite gotten hand coordination entirely, but she loves her new field. We've done some adaptations on her computer systems. We've talked to her graduate student supervisors about accommodations, and she's gone on to present papers at national meetings. It's been very exciting to see. So that's a little story about what I do with some of my patients. How did I get from here to what I'm doing now? I went to medical school, a nice medical school back in Philadelphia, and then moved out here to Seattle to do some further training. I did an internship, just like all doctors do, and then I did a 3-year residency in physical medicine and rehabilitation, actually here at the University of Washington. After I finished my residency, I did a year of training in research afterwards. And then since then, I've done a number of different things in my career. I spent 3 years at the VA hospital, which was a wonderful experience, and I really got to know a lot about our veterans and the service that they give to the country, and it's really helped me a lot because some of the research that I'm doing now is in active duty military members who return from combat with traumatic brain injury. So that was a great learning experience. I've spent some years in private practice treating people out in a community hospital and in a pediatric rehabilitation setting, which again gave me a whole other slice of life. And for over 20 years now, I've been back in this academic setting doing my research and teaching and trying to kind of bring physical medicine and rehabilitation to a larger setting so that people understand it and can really value function in their lives. I think that pretty much sums up my life and what I do and how I've gotten here. I hope I've provided you with a better understanding of the diverse specialty of physical medicine and rehabilitation. I'd invite you to learn more by listening to my fellow members' stories. And for more information, please contact the Academy at infor, I-N-F-O-R, at aapmr.org or visit our website, www.aapmr.org. Thanks a lot for listening.